Okay, this is Athena Jezik. We're going to do a little bit on the neck and a little bit on the face. We just finished with her abdomen, and I'm curious as to if it gave her any relief to the experience of the tension that's going on in her stomach. So she says that it has helped a little bit. It's made her feel a little bit better. So moving those fluids and releasing just those tight muscles can help. Okay, because we're going to be on the face, I don't like to use a lot of oil, but I do need to get a little bit on. So I'm just going to put a very small amount on my fingers. Just to give enough so that, okay. And I always start out doing a little bit of lymph work just to get the fluids moving. So just a little neck chain work here. And then I'll get into the muscles and just always go upward with the face. The skin of the face has a lot of exposure to the wind and to the sun and to the elements, and so the tissues need to be swept upward. It gives them a little more strength. They're also, of course, experiencing gravity, and they do a lot of facial expression. So there's a lot of muscles in the face that just need to just relax. And sometimes there's a lot of jaw tension. Just the jaw comes in right here. You find that some of the culprit muscles run along the mandible and coming up, attach. And again, take a look at an anatomy book and get an idea of what the muscles are looking like, where they're going, where they're attached to, how deep they are. And here I'm going down deep enough to actually massage where the teeth come out of the gums. There's right at the tooth line, the gum line there. You can actually get down there and feel it, feel the individual teeth. Back to the back to where the jaw, and then you can come in a little bit on the top jaw. That's not quite as distinguishable because of the cheeks, but you can still get there and work in like so. Under the eyes. You want to be careful when you're close to the eyes. I'm going to show you there is a lymphatic technique where you actually get a hold of the eyeball. And you want to do that very gently, and if people have contacts in, you don't want to do this, but you kind of get a hold of the eyeball very, 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 very gently. You might want to try it on yourself first just to see what it feels like. And then kind of rotate the eyeballs in and out, but it's a very delicate rotation, and you just go like inward and then outward. You can't go very far with this, but that helps to drain some of the lymphatic vessels that are around the orbit, and it's very relaxing. And actually, when you do that, when you get the fingers to feel it, there's a lot of movement that you can feel, and also a lot of fluid that you can feel moving around that eyeball. And then, of course, lifting up the nasal bones gives a little more space in that area. Sometimes some of the pollens or pollutants that are in the air create a lot of burning or eye watering going on. Sometimes just straining eyes after looking at a computer for a long time might cause some watering of the eyes. So it's nice to have a little bit of attention to them, helping them drain and feel like they can get their space back. And then I'm just going to give a couple little neck rotations here, just to make sure that we get everything nice and relaxed. And just running down. Being very careful of the front of the neck. Make sure you're on the sternocleidomastoid when you do this. And then if you're getting into the scalene muscles, just be sure that you know where you're going and what you're doing, because there are structures there that should be treated with care. And this is an occipital base release, just to open everything up. Because when we're not feeling good, we can feel surprisingly better if we're relaxed out. Not that everything's going to go away and we'll be perfect in an hour or two, but it does really help the body. I can't tell you how many times people have come in a lot of pain or a lot of discomfort and left feeling different. Even though they didn't get completely over what it was they had, the significant difference was so valuable to them that it made everything much more tolerable, and they moved through it much quicker. So looking at this preventative understanding of taking care of the body as the body's telling you what it needs and paying attention to that rather than waiting until it breaks and then working to fix it with things that don't really fix it, it would change a lot of people's existences and the way that they live. So I urge you to take a look at that and see if it's something that you would like for your life. Okay, this is Athena Jezik on a dreary winter day in Austin, Texas.